were seeing high demand for mental health services. And at the same time, pre-pandemic, what we knew is that there were not enough individuals coming into the field. Like we were at like the state of California, looking outside Kaiser Permanente, was projected pre-pandemic to be a minimum of 6,000 licensed therapists short, and potentially as many as 20,000 if we're going to try to meet the state's unmet needs.
Well, we're part of that pipeline in the workforce to increase the amount of mental health providers. We want to make sure that there are folks that represent our communities in terms of language and culture and different backgrounds.
Hello, everybody. Josh Rubenstein, Media Director for Kaiser Permanente, Southern California. Over the last few years, we have seen a seismic shift in the way in which we address mental health, the way we think about it, the way we talk about it, the way we feel about it. Growing calls to reduce that stigma of mental health, along with shifting priorities in the way in which we deal with increasing demand for mental health services. It's an interesting number. 1 in 3 people in the United States lives in an area with a mental health care worker shortage. And of course, this disproportionately affects communities of color and people who live in low-income areas. We need more people who are licensed and trained to deal with this urgent need. So, this video series, we are putting a spotlight on what we're doing to increase that pipeline of behavioral health professionals. What Kaiser Permanente is doing to find those professionals, diverse people who can deal with the need that is out there right now. You're going to meet 2 of our leaders from the Kaiser Permanente Mental Health Scholars Academy and Behavioral Health Training Institute, Gloria Martinez and Dan Gizzo. Take a look. Dr. Dan Gizzo, clinical psychologist. Tell me, first of all, why did you get into this business?
Oh, well, that goes back some time. I've been a clinical psychologist for, well over 20 years. Initially, I got into mental health, kind of by accident. I did an internship when I was an undergrad, and I worked at a children's facility, and something just kind of clicked for me that, made it kind of an interest area. And, I ended up, going into graduate school and pursuing the PhD. And it's been kind of a journey and a lot of different roles from there on.
You are, you deal with people's worst problems. And I would assume it takes a special person to be able to take that in all day long. And not only be able to take it in, synthesize it, help, but also make sure that you don't get affected by it.
Sure. Yeah. One of the most important things about working in the mental health field is practicing good self-care. It's like the old airline adage of, put on your own mask before you put the mask on the person next to you. Yeah. So it's about, making sure that you're able to be authentically present for, each member or patient that you're working with. And so practicing self-care is a part of that. Learning about psychotherapy and, learning the, different ways of helping individuals, really is a key part, right? So, when you learn to be a therapist, you're learning evidence-based techniques, you're learning, kind of methods, and it might look slightly different for each patient. At the core is kind of a connection between the therapist and the patient. We call it the therapeutic alliance. And so, individuals who have, kind of a interest in connecting with others, individuals who are able to kind of, be present in a real way with someone in a, whether it's face-to-face or over video in kind of a setting where potentially you're discussing very difficult topics. We're making sure that all of the therapists are trained with ways of both being present, ways of helping their patients, and ways of making sure they're taking care of themselves simultaneously.
It feels like there's been this seismic shift in the way in which we look at mental health. and it's changed so much in a very short period of time. Have you noticed that as a therapist?
I would say there's been a number of shifts over time in my career. There's been a shift from looking at the practice of mental health from kind of a more interpersonal or a the kind of the art of doing therapy into more the science of doing psychotherapy. A shift in terms of research and evidence base for the methods and techniques that that are taught and used. Um, but thinking more recently, what we've seen is a pretty seismic shift over the course of the COVID-19 pandemic. I would say that one of the things that, if we're looking for a bright spot coming out of the pandemic, is it's put a spotlight on mental health and the mental health needs that have been unmet for a lot of individuals. And so interest has surged. And people are that maybe would not have sought help in the past are seeking help now. And so that's been a really seismic shift. I think it's highlighted in, it strains the nationwide, it strains mental health service delivery. But it's, I think, an important shift in terms of general population-wise awareness of mental health issues and needs.
Well, I want to drill down a little deeper on that because you just mentioned that there's been this strain on the profession.
Yeah.
Tell me why you see that happening and where you see it going.
Yeah. So I think, in terms of the strain on the profession, anecdotally, we're seeing high demand for mental health services. And at the same time, pre-pandemic, what we knew is that there were not enough individuals coming into the field. Like we were at like the state of California, looking outside Kaiser Permanente, was projected pre-pandemic to be a minimum of 6,000 licensed therapists short, and potentially as many as 20,000 if we're going to try to meet the state's unmet needs. And so, we kind of have a perfect storm in some ways of projected shortages in our workforce coupled with increased demand. And so that's what strains the system. Um, there's other issues though, like when you think about, like, you look at the workforce in California or nationwide, historically there's a lot of groups that have been underrepresented in our workforce, and so that's been another area that I think has come to light in recent years. State of California, we know that Black African Americans, Latinx community, and Asian American Pacific Islanders, for example, are all underrepresented in the mental health workforce relative to their portion of the population. And so that brings with it language skill needs, right? Like individuals, like we think about psychotherapy, it's conversational. We're using language to interact with one another. And so there's also a need for more bilingual individuals. So the workforce is strained in a couple of ways. Part of it's like just needing to bring more people in, but
Mm-hmm.
part of it's also a little bit of needing to change kind of who's coming into the field to make sure that the workforce really is a better representation of who we are as a community.
Is this really kind of where the Mental Health Scholars Academy and the Behavioral Health Training Institute kind of come in,
Yeah,
where Kaiser Permanente saw a problem and this was a way to at least start addressing it?
absolutely. Really, I think in terms of forward thinking, the organization saw, again, pre-pandemic, that there was going to be these workforce shortages. And so looking at different ways to bring individuals into the field. And, the idea was to create a new pipeline. Like, can we take individuals that are already working in our organization and give them an opportunity to go back to school, earn a master's degree, and join the mental health workforce? And so that was really the concept for the Mental Health Scholars Academy, was kind of a new pathway into the field, really targeting our own employee base. As it turns out, that works really well because Kaiser Permanente is a very strong employer from a equity, inclusion, diversity standpoint. So what we've seen as we've opened this invitation to our employees in California is that we're getting a very robust response from underrepresented groups. And we're getting a much higher level of bilingual individuals than we anticipated. We were hoping for 25%, and we've been running about 40% bilingual
Mm,
participant since we
that's great.
started back in 2020. Um,
And
yeah,
I'm jumping ahead a little bit because
yeah,
I think we probably have to rewind. Tell me what the Mental Health Scholars Academy and the Behavioral Health Training Institute, what those two things are.
yeah, no, absolutely. So the Mental Health Scholars Academy is really kind of a new pipeline, like a new pathway to bring individuals into the field. And so the idea is that we provide tuition support and mentoring and connection for training placements to eligible Kaiser Permanente employees. Um, and like those employees, they need to already have a bachelor's degree from a regionally accredited institution. There's kind of a series of criteria, but they can apply into our program, and we pair them. We work with partner academic institutions, so we pair them up with master's degree programs in either social work, marriage and family therapy, or clinical counseling. And so we help them get to school. We help them to be successful in school. Now, the Behavioral Health Training Institute comes in filling kind of a really critical gap because the mental health book learning is really important, and the academic part really sets the basis for participating in the field. But you need the supervised clinical experience to learn how to actually be a psychotherapist. You need to kind of get in a place where you're working with a supervisor and you're working with real patients. In an office setting, whether it's live in person or virtual, and receiving supervision and training kind of on the job. And so those are all required for individuals to get a master's degree. You have to do typically a practicum. It can be a year long. It's anywhere from 400 to 800 hours depending on the program. And the Behavioral Health Training Institute, they really fill that gap of providing high quality supervised clinical experience for the students, and they're able to do it right in our Kaiser Permanente clinics. And so it benefits our members, it benefits the students, and it really helps us fulfill our mission as an organization.
What would give me that piece of advice that you give to that one person who's sitting here going, I think this is what I want to do with my life?
Yeah, I always say, if you're interested in working with people and you would like to have a career where you will absolutely never be bored for a single day of your career, join our field. It's really there's no days where you don't find inspiration. There's no days where you don't find an opportunity to help another person. There's ample opportunity for specialization. We need people that want to work with young kids, with teenagers and adolescents, young adults, with geriatric patients. So there's a lot of opportunity regardless of where someone's interest lies. And really, it's a chance to be an integral part of the healthcare system. So I think we see a lot of interest from people who are already working in healthcare, but maybe they're not in a patient-facing role. And they've maybe always dreamed of I would love to be a provider. And maybe, there's been financial barriers, because it's expensive to get a master's degree. And so, really they look for ways to work around those barriers. Our Mental Health Scholars Academy for some is really a way around those barriers.
That's fantastic. And thank you so much for everything you are doing, Dr. Dan Gizzo. And we can't tell you how excited we are about these two programs.
Great. Thank you.
So Gloria, tell me a little bit about you and how you got involved with this program.
So I am a licensed marriage and family therapist and registered play therapist supervisor. I've been with Kaiser Permanente almost 13 years, and really going back to when I was placed in my own practicum, which is your clinical placement when you're in school to do your hours that are required for graduation. I had a phenomenal supervisor, and she really instilled in me this passion for supervision. And also I have a deep-rooted belief in being of service and giving back. So I felt that this was one of the best ways I could give back to my profession, which is to be in a position to support student programming, pre-licensed programming through supervision, and specifically through KPBHTI.
I want to go in the Wayback Machine, and I want to know why you wanted to be a therapist. What is it about this particular career that drew you in?
I grew up in the San Fernando Valley, and I was really of humble means and really, had some adversity growing up. And I really had an understanding that there was something bigger out there, and that maybe in my family system, in my community, in my culture, that we hadn't really been a part of it yet. And so I, at a very young age, knew that I wanted to give back. I knew I wanted to be of service and be in a career and immersed in a setting where I could do those things.
The one thing that we've talked about on these conversations before, and this is in terms of all kinds of medical work, whether it is a regular general practitioner, a surgeon, or a mental health professional. How important is it that the person who is seeking help is getting help from someone who looks like them or has who experiences that they experienced, so that there is that common understanding?
I had deep pride as a young woman of color to have these, families who would allow me in their home, whatever the circumstance was. And sometimes the work was like, I'm not here to call social services on you or take your child away. I'm really here to help you as a family come together to understand the situation, and kind of build you up so that when I'm not here anymore, you have the tools and resources to do this stuff together. And also so you don't depend on me and think that it only got better because I came in the room, then I'm not doing my job. I hope you feel like I was able to bring all of this up to you.
So tell me about the Behavioral Health Institute, Training Institute. How do I get into it? What is it? How does it work?
So Kaiser Permanente was really innovative in that we already knew there was going to be an anticipated mental health shortage or provider shortage. And so when that happened, they created the Mental Health Scholars Academy, really in California. So an initiative to create a pipeline, a workforce pipeline to meet the growing demand for mental health providers. In this moment in time, I could say that the acuity has increased. A lot of folks' mental health has really been impacted, especially since the pandemic with COVID-19 and isolation and all the things that have happened, and also at a younger age. So not only are we anticipating that there's going to be the shortage of mental health providers, but the demand has increased, and then the acuity of those symptoms have also increased. Southern California launched the KP Behavioral Training Institute so that when the scholars that were selected through MHSA needed to do their practicum, their clinical hours, they could then apply for their traineeship, their practicum in Southern California. Our goal really is to be a premier training institute to provide an innovative approach where we are using evidence-based practices, where we set them up to be successful in the career, in the profession in the long term. We really want to focus on that self-reflection, to build some skills and insight to reduce burnout that happens with folks when they are in professions of caring for others. We strive to ensure that we use cultural humility in all that we do. So cultural competency has kind of an assumption that I looked into this, I learned what my bias was, and once I've done the training, I can check that box and I am competent. But as we know, especially with seasons of life, is that really we need to have and sustain a lifelong learning perspective where we have curiosity and the desire and openness to receive feedback, to learn from ourselves, learn from each other, to be aware that we all have bias. And it's not that we won't have bias, but be curious about it, and then have that self-reflection and take the time and intention to ensure that we're not avoiding it, but being really present with it so it doesn't interfere with our work, and also so it can enhance our practice so we could be more present with people to say, oh, that's my bias. Let me just pause a little bit so I make sure that I hear them and their story from their lens. And so we had our first cohort in January 2022. So this January will be 2 years, and we're in this place of enthusiasm to say we're really in a place to create that workforce of the future. So how do we stay innovative? How do we stay curious? How do we have quality training for the whole person. So our trainee, the care that they provide to patients, that patients feel really confident that they're receiving the best care under the trainee and the supervisor who's supervising the trainee, and that person feels confident and ready when they graduate to continue their postmaster's work and be an associate there, be pre-licensed, and really feel set up for success. So we're invested in the whole journey. We don't just think of like our role. Well, we're part of that pipeline in the workforce to increase the amount of mental health providers. We want to make sure that there are folks that represent our communities in terms of language and culture and different backgrounds, different stories, different like circumstances. And also that we think about it from that lifelong learning perspective, that they should always continue to seek information and training so that they can continue to grow in their career and maintain their engagement so they don't lose touch. And so we instill that early on so that they can develop a practice that hopefully is very healthy and balanced for them and for the patients that are receiving care.
Love this program. We're going to talk to some of the students enrolled in this and talk about their journey. I'm so excited that you are leading the effort based on what you've been through. I've loved hearing your story. Thank you so much for raising the flag and getting my attention on this program, because I think it's absolutely wonderful.
There's a lot of stigma around mental health, right? But especially in the marginalized communities, I feel like collectivistic cultures don't really understand what mental health is referring to. I think that everybody has anxiety, so they think it's just anxiety, like you can move past it. Unless you're actually in that situation, you don't know what anxiety is, right? So there's a lack of support around us. And so for me personally, I felt that it was very important to be educated on different cultures and what their experiences are like.